Good afternoon. Thank you for joining me today as I give you an update on COVID-19 here in Erie County. We have 99 new cases of COVID-19 to report since last evening, which brings us to a total of 15,783 cumulative cases since March. We also, unfortunately, have 3 additional deaths to report, which brings us to a total of 402 deaths reported in the NED systems of Erie County residents. It really is truly alarming to get to that number of 400. This virus has taken its toll on so many in our community, and the deaths certainly point to that. The mortality rates are most common among people ages 65 and up, and 69% of the deaths have occurred in our long-term care facilities. But this virus has also claimed the lives of people in their 20s. 52% of those who have passed away are males and 48% are females. Of those who have passed away here in Erie County, almost 82% have been white, with a little over 5% being black residents and just a little over 1% being Asian, and then 11% being unknown. The positivity rate for Erie County was 11.9% for January 22nd through 28th, according to the Pennsylvania Department of Health. And as of this morning, we have 44 total COVID-19 hospitalizations in our Erie County hospitals, with 7 people on ventilators in Erie County. Interestingly enough, our wastewater data shows a sudden jump in viral levels, more than doubling from the week prior. This is very different than the trend of cases identified, which may suggest that individuals who may have mild cases of COVID-19 and think they have symptoms such as of cold or allergies are not getting tested. So I encourage people to go get tested. Testing is still very, very important. Please continue to ask what they can do to help slow the spread of COVID-19. What can you do while you wait for the chance to get a vaccine? Well, first of all, get tested if you are having even mild symptoms. It's really fairly easy to get a test now in Erie County, and it only takes a few minutes, and it's an important step in protecting our community, those you love, those you work with, and yourself. And there is a list of testing sites at eriecountypa.gov, and all the information for contact at those sites is there. You may recall, it wasn't that many months ago, that it took time for testing. Testing was less available, and this truly is a situation we're seeing now with the vaccine. We're going to have to be patient for just a bit longer to have enough vaccine available for everyone who wants to get it. And we can expect that to happen later this year, just not today, not tomorrow. It will more likely be summer before many people will get their first dose. If you are not in the high-risk category, the best thing that you can do for the community is to wait. We do hear anecdotal reports of people who have gotten the vaccine, found some way to do that aren't on that priority list. And so I ask you, if you're not on that priority list, even if you can get a vaccine, please give that space, that spot, to someone else who is on the priority list. The state has developed phases so that the most vulnerable people can get it first when it is available. Please understand that we have tools that work as well as the vaccine available to us right now, even for our seniors and our most vulnerable population. And those tools are to wear a mask that covers your nose and your mouth when you go near anyone that does not live inside your home. Keep a 6-foot distance from each other. Stay home as much as possible, and definitely, when feeling any kind of illness, stay home. Wash your hands frequently and limit your activities, especially within large groups of people. Now that we're hearing about these new variants of the virus, we need to truly double down on these mitigation efforts. We've been told that the variants aren't more deadly, but they are more contagious. So that means more people can get the virus, and some of those people will get very sick, and unfortunately some of those people may die. I understand that it's getting more difficult to fight boredom and frustration of staying inside. I feel it myself. Of course, we all love a sunny day like this. I think it helps to lift our spirits. But there are safe activities that you can do outside. I like to go cross-country skiing. Some people like to snowshoe. Some people like to ice fish, or just hiking and walking your dog. Find a place where the sidewalks are shoveled or the roads are clear to keep yourself safe, hopefully from slipping. Maybe those trackers that you can put on the bottom of your shoes would help. But there are places where the public services are there to get the sidewalks clean, and we ask all of you who have a sidewalk to try to keep your sidewalks clean so that people can get out and get some exercise. So all those outdoor activities can be done while wearing a mask and keeping your distance from others, while giving you a chance to get some fresh air, to clear your mind, and to maybe give you just a bit of different perspective. Another thing that people can do is support each other, particularly the seniors who don't maybe have access to the internet. So do you have a family member or a neighbor who is in the category of 1A, who should be trying to get their vaccine now, but simply doesn't have the knowledge base or even the access to get on the internet and try to do that? Give some of your time and help that person navigate this. You can find frequently asked questions about the vaccine at eriecountypa.gov. And again, if you don't have access to the internet, you can call 877-724-3258 for more information. That's 877-724-3258. So I'm just asking you to do your part while we all continue to do ours. And now I'll ask Director Melissa Lyon from the Erie County Department of Health to share with us an update from the Health Department. Melissa?
Thank you, County Executive. It's always a pleasure to join you on these press conferences. I know the COVID-19 vaccine is really on everyone's mind. It's the next solution to us getting through this pandemic. And I know that everyone's looking to get a vaccine, and that has been a struggle. So today, I want to provide a description of how the COVID-19 vaccine ordering and approval process works for the Commonwealth of Pennsylvania, from the local level to the state level. Keep in mind that each state has their own system for how they order and approve vaccine. So I will be speaking specifically to the Commonwealth of Pennsylvania. So here in Erie County, there are approximately 18 approved vaccine providers. This excludes the pharmacy providers. There are approximately 5 corporate pharmacy providers in Erie County. Each week, the approved vaccine providers submit an order for vaccine using an electronic system. These orders are collected by a specific deadline each week, and they are compiled for the entire state of Pennsylvania by a vaccine team at the Pennsylvania Department of Health. So they know what the expected demand is throughout the entire state. These requests are then compared to the amount the federal government has allocated for Pennsylvania for that week. Unfortunately, to date, the orders significantly exceed the supply. So again, the orders are significantly exceeding the supply of vaccine allocated to the state health department. So therefore, the orders are being filled at such a much lower rate than the community's expectation, because there's just not enough vaccine to fill each order completely. One example that I'm aware of is a provider ordering 50,000 doses and only being approved for 1,000 doses or less. Once the Pennsylvania Department of Health determines the amount of vaccine that will be allocated to each provider, that is then communicated back to the provider using the state immunization system. The information that they share includes the delivery date of the vaccine to the facility. The vaccine provider may only know 1 or 2 days prior to vaccine arrival. Therefore, they are not putting slots of times for people to become vaccinated because they're not sure that they will have vaccine to fulfill those slots. The system is working, but the amount of vaccine is not available. It is insufficient to meet the demand. Please be patient. We are confident from a public health perspective that the vaccine will become more available. months ahead, we will be able to do larger clinics. The second point that I want to review is that the Erie County Department of Health's role in vaccine distribution. Typically, a public health department is responsible for vaccinating populations that are under or uninsured or unable to receive immunizations due to other significant barriers. The Erie County Department of Health is a last resort for health care and immunizations. Hence, it is incredibly appropriate that the hospitals and healthcare systems and healthcare providers receive the first doses of vaccine to be administered to the community. From a public health preparedness responsibility, the Erie County Department of Health is responsible to plan and leverage partners for mass distributions for therapeutics. We've been planning this for many years, and since 9/11 is when money became available for public health emergency preparedness. And those therapeutics can be things such as antibiotics. In this case, it's vaccines. We refer to these distributions as point of dispensing or pods. And I can assure you that many aspects of the planning are well underway, and in some are actually in place and ready to go once vaccine becomes available. Such things as secured locations for the community vaccination clinics, provisions for manpower, data entry. Currently, and unfortunately, the limiting component is vaccine availability. It is trickling in and not arriving in mass quantities. When we get large quantities of vaccinations, when that happens in our community, I am confident that the public health partners will be ready to go. Thank you, County Executive. Back to you.
Thank you, Director Lyon. And we are going to now turn to the media for questions, and we're going to start today with Jet TV.
Hi, it's Chelsea. I was wondering, you said that facilities would be able to have a better or clearer sense of when they would be able to receive vaccines, but is that public information? Will the public be able to know approximately how many vaccines are available, each week or maybe even a month at a time?
I'm going to turn that to Director Lyon, please.
Yeah, so the State Health Department does have a dashboard where they are capturing that information. I would say there's definitely a lag between the information that is on the dashboard versus what is actually the information here in the community. But for example, I can let you know that we have been trying to gather data locally, and I'm looking at my other screen, so I apologize. And of the 18 providers that are approved to receive vaccine, we only had 9 receive vaccine the week of January 29th, and many of those received only 100 doses. So we're trying to have a real-time feel for that, and I can discuss with the team moving forward the value of having that information available weekly. So thank you.
Thank you, Chelsea. Erie Times News. David?
Yes, Kathy. This question's for you or Melissa, or if you both want to respond. You mentioned, there's just not enough vaccine to meet the demand right now, but we have seen some locations start to give vaccinations to folks in the expanded Phase 1A group. We saw LECOM Center on Health and Aging start on Friday. The Rite Aid pharmacies are doing it. Giant Eagle pharmacies are reportedly doing it. But there's a lot of glitches, and people are getting very frustrated. Is that inevitable? Is that, from your thought, strictly because there's not enough vaccine, or is there a smoother way that these organizations could roll things out even at this early stage?
Melissa, would you like to address that?
Sure. Thank you, David. To be honest, I think the facilities that are responsible for receiving the vaccine, scheduling the appointments, and then administering the vaccine have very many frustrations themselves as far as the demand is exceeding the supply. Do I think it could be done smoother? I don't. I think they're doing the very best they can with the aspects they have to work with. Realistically, if they had more vaccine, I am confident you would see more slots available for more appointments, and then more people getting access. What's happening right now is vaccines coming, we know, like a day or two in advance. They put up the appointments get filled very quickly, and then they have to wait to find out what vaccine they get for the following week. It makes for difficult planning.
Okay. And I just wanted to follow up, Kathy, with you, with the comments about, if someone, is kind of jumping the line, I think is what you were kind of alluding to earlier in your initial comments. Are you talking about people who are not in Phase 1A they're going ahead and trying to get spots instead of people in Phase 1A? Or are you talking about people in some of the categories of phase 1A that haven't been getting vaccine until very, very recently.
Well, again,
Yeah, that aren't healthcare workers.
This is anecdotal. I don't have any hard data behind this, but we're just hearing anecdotal reports that some people that may be in 1B, not in 1A, have already gotten their vaccine. And I guess to your question, really, and yet we know that there's still thousands of people in 1A. Our senior citizens, 65 and up, those between 16 and 64 who have a underlying health condition that would make them eligible. There are many of those people still unable to get their vaccine, and so I'm asking people, if you are in the next group, to wait your turn. As much as we all want the vaccine yesterday, I ask you to please try to allow those that are much more at risk to get their vaccine and leave that spot open for them. Now, I do know too, and I don't know where this exactly might have happened, but at the end of the day, no one wants to waste a vaccine. So if there are a few doses left, somebody may get one who's in another category, but we're hoping that it really sticks with the seniors and those with really serious underlying health conditions at this point. Thank you.
Okay, thank you.
Erie News Now.
Hi, question for Director Lyon. Director, how much do you worry about these new variants out there, these mutations, especially these ones that appear to be more transmissible, even though our numbers have kind of leveled off in terms of cases and hospitalizations? How much do these concern you?
Thank you for the question. Very concerned from a public health perspective for our country should these variants become the primary virus that's circulating in our communities, because it is so much more contagious. And then the effectiveness of the vaccines against that virus seem to be efficient right now, but at the same time, we've not put them to the test of it being the primary virus circulating. So I'll be honest, it is a concern, and I think every public health practitioner feels that same way. We're sort of a race against the virus and its mutations. So the sooner we can get people vaccinated and really get the spread of this disease under control, we'll be in a better place. Thank you.
And Director, just how important is it then to be getting needles in the arms of those older people, those people who, if they get it, someone my age probably statistically wouldn't end up in the hospital or die, whereas someone older is far more likely. So how important is it then to be vaccinating right now older people before a possible surge?
Thanks. So the importance of keeping the most vulnerable populations, and just strictly by age, that does put a category of being just more vulnerable because of your immune system not being able to fight off the virus. And so from a public health perspective, we have always talked about needing to prioritize how we would distribute therapeutics during a pandemic. And this is one of those areas where we've had to make some priority categorizations. I think every single person is important, but right now we're needing to focus on those that are 65 and older, and our general population is very important. We do want to protect them from the virus and have them live the longest, healthiest, happiest life that they can. Thank you.
Thank you. We'll go now to Joel with Talk Erie.
Yes, thank you, County Executive. Here's a question for Director Lyons. Melissa, in earlier pressers, it was indicated that a manpower shortage was also a limiting factor to vaccine distribution. Has that now been fixed?
Great question. And in fact, I was listening to the State Department of Health's press conference today around vaccine, and they had asked a similar question. So if vaccine is the limiting problem right now, or biggest challenge, then what is your second largest challenge that you're foreseeing? I thought they might say manpower. They did not. They talked about messaging. And I don't think manpower is as critical at this point, because we have had some time to put provisions in place. Talking with our healthcare systems and our partners there, it looks like they would be able to help stand up some clinics with us, as well as putting people into the voluntary system. We've had individuals just reaching out, asking if they can volunteer, and we're using the Medical Reserve Corps, what's called Serve PA, to register those individuals. and then we'll be making calls, whether that's electronically or physical phone calls, to bring them on board. So the manpower issue will always be a concern, but right now I think we're sitting in a better position than we were a few months ago. Thank you.
Just a quick follow-up for you, County Executive. Do you feel like it's appropriate to have a pecking order within Phase 1A? It's, I mean, again, it's a very, very large category, but if you're in 1A and you can get the vaccine, that shouldn't be a problem, right?
No, it really shouldn't be a problem. I think anyone in that phase that was listed, if they can get in and get an appointment, they should go right ahead and do that. And honestly, the group that was probably most at risk, the healthcare workers, they are, for the most part, completed with their first shot, and some of them, many of them still are waiting for their second. But I think that was the group that was really crucial to get done, and they are pretty much completed. But yes, everyone else who's in 1A, if you can get in and get a vaccine, go for it.
Thank you.
We'll go back to Jet TV and Chelsea.
Hi. So it was said that underfunding was part of the issue in terms of getting vaccines to the community of Erie County. What is being done now, especially with the governor's budget proposal addressing public health as a primary thing of importance? Where can we expect maybe more funding so that Erie County can receive more vaccines?
I'm going to let Director Lyon address that.
Thank you, Star. I think from the governor's perspective, from what I understand, we have been advocating for a very long time, my entire 7 years as the public health director in Erie County, for a more robust, funded from a state level public health infrastructure for the county municipal health departments, but also throughout the entire Commonwealth. I think the pandemic has clearly put into works what the governor's proposing, and how do we appropriately fund public health so we don't run into these barriers in the future, and that we're more resilient when the next pandemic comes, and Lord knows there will be another one. So will the money be coming right away to address the vaccine issue? I don't think that's coming out of the governor's proposal. That would be coming out of the federal government. What I do know they're discussing is how can you get that money to the locals quicker, faster, with less red tape per se, or strings attached to get that money approved and into the hands of the locals, so that we can be using it effectively and efficiently to get the work done. As far as monies being part of the problem to get vaccine to the communities, I'm not aware of what was said or who said it, but I would say the vaccine supply is strictly at a federal level from a manufacturing and then distributing. It should take time.
Thank you.
Thank you.
Erie Times News, David.
Sure, Kathy. Another question, if I can get a response from you and from Melissa on this. Back in June, we saw that the percentage of cases among African Americans in Erie County was about a third. We were talking about it. Why was it so high among African Americans? The latest, I think you said this week, it was 5%, and I know on the website it's cumulative for the entire pandemic. I think it's 7%, which is lower than the percentage of African Americans living in the county. What has led to that welcome decline in percentage, going from 34% at one point in June to 7% of cases now?
Sure, David. I'm glad to answer this, and then I'll let Melissa also answer it. But I want to clarify, what I was talking about today was 5% of the deaths in Erie County have been residents that are black residents. So that's the deaths. So
5% of deaths, I think 7% of cases.
Exactly, yes. Back in June, we saw a trend happening in Erie County that was happening actually in many other places in the country, as we know, and that those who have suffered from health disparities for decades were really one of the most vulnerable populations. There's a multitude of reasons why that was so, but the Erie County Department of Health, particularly their Health Equity Division, saw this trend, jumped in, got partners out there in the community who really actually were the ones saying, we need help here. You've got to come in and assist us. And so the health department saw that request, saw the need, and did jump in. And we've talked a number of times about so many of the different efforts that have been done in communities of color particularly, whether it be having resources in multiple languages, whether it be boots on the ground, which really was the volunteers and the people who care and about those communities so deeply, going door to door and trying to get the message out, getting masks into people's hands. They were dropped right at their residence, for example. And now, of course, we have the testing going on in all 3 neighborhood centers within the city of Erie. So that has, I think, collectively combined to really drive down the really unusually high and numbers that we saw in those communities that was really needed to be addressed. And I'll let Director Lyon kind of add anything more to that she wants to.
Thank you, County Executive. I don't have more to add around the specifics, but I would like to really acknowledge that the community leaders were the champions of those efforts because they leveraged the resources that were available to them from healthcare systems, the health department, the university. They brought together some of the heavier hitters, per se, in the community and said, can you help us address this issue that we're seeing, and we're seeing it across the nation. And so in all reality, those community leaders were the champion behind the efforts, and we just pulled together resources to make it happen with them. So thank you for that.
Sure, and just one quick follow-up. Is there any concern that the drop in percentage is due to a lack of reporting? Particularly when you mentioned there's a concern that a lot of cases aren't being confirmed right now based on the wastewater treatment data that Dr. Nadworny provides. Is there any concern that that might skew those percentages, that we're seeing maybe a higher percentage of African Americans not going to get tested?
Thanks, David. I don't think that it's specific to the African American or Black population not going and getting tested. I think across the county, across the state, and across the country, we're seeing lower testing numbers. So it's not just specific to them. So I can't really understand exactly why the testing numbers are down. Like we said, we've talked about, is it because they are having more mild symptoms and they're able to just take care of themselves at home? They don't want to know if they're COVID-19 positive. I think that there's access to testing at this point. So it just seems to be the trend throughout the pandemic. So I hope that answers your question.
Thank you.
Erie News Now. Ethan.
Hi, question for Director Lyon again. I know you're not going to sit here and give out all the details of what it would look like, but can you get us a little closer to roughly what a mass vaccination site might look like, sort of what that process would be like as, fingers crossed, we inch closer to those?
Thank you for asking. So I have mentioned that for as long as public health emergency preparedness funding has been available, we have been responsible to figure out how you would get therapeutics to every single person in your community. And so when we talk about that, there are a number of planning assumptions that go into those plans. So one of them is, how do you prioritize and who will the partners be? So right now we have healthcare partners that are doing a lot of the frontline vaccinations. You'd usually find there's a couple of methodologies behind this. You can use large locations. Convention centers tend to be particularly good sites because they can handle a lot of people. They have good parking. They usually have multiple egress and exits. And then the others is to do a bunch of smaller ones throughout a community, because maybe it doesn't make sense to bring everyone to one location to receive their therapeutic. Maybe you're doing them in multiple locations within a county. So school buildings have been selected in the past. In this particular instance, school buildings would not be utilized, but that's all part of the planning assumptions when you're doing that. And then how you promote those depends on what the therapeutic is. In this case, we're going to go by the phases, and then it will likely be a scheduling or by appointment, because we don't want a lot of people gathering to potentially spread the virus. So And the planning assumptions are what drives that. And I know I didn't give you a ton of specifics, but I can tell you that they're in the works as far as the plans. And I'm confident that when vaccine becomes available, Erie County will be able to do a really good job of vaccinating thousands in a day. Thank you.
And Director, how much of that would depend on which vaccine is being given out? Is it a situation where if you had Pfizer or Moderna, you might hold one larger clinic, whereas if you had the Johnson & Johnson one that doesn't require so many specific things like super cold temperatures and multiple doses, where you might take that to smaller clinics throughout the community?
Yeah, thank you. As far as the manufacturer of the vaccine, at this point, it would not be a limiting factor. I think we've secured enough locations that have ultra cold or cold. So whatever therapeutic would be available, I think we're in a position to administer it. The second doses is where then it becomes a little more challenging. So if we're offering multiple manufactured vaccines, then how do you assure that they get the appropriate second dose? That's a little bit of a logistical conundrum, but in general, I think we'll be in a pretty good position. Thank you.
Thanks.
Joel, talk Erie.
Yes, thank you, County Executive. Another question for Director Lyon. Melissa, this might be a bit technical, but can you help us understand how the state is discovering whether one of the disease variants are present in the testing? And how would we know here in Erie County if that UK variant or that South African variant was here in Erie County?
Yeah, thank you for that question, Joel. The plan, how this is happening right now is the Bureau of Labs is really the public health laboratory for the Commonwealth of Pennsylvania. And prior to the Bureau of Labs receiving certification to do the sequencing, they were collecting samples and then randomly selecting samples to send to the CDC for sequencing. And then they were targeting certain samples as well based around some scientific alleles available in that sequencing that said, that's curious, let's send that for additional sequencing. So there was targeted and then there was random. How many samples the state was sending to the CDC, I don't know. And I don't even know if Erie County samples had been selected. I actually asked that internally if we would know. Now the Bureau of Labs, I believe, is able to do that sequencing locally here in the state or in the Commonwealth. So we should know quicker as opposed to the turnaround time to the CDC labs. I would hope that the Department of Health would let Erie County know before they went live with any variants identified in the community, but in reality, that would be coming directly from the Department of Health. I hope that helps explain how those variants are being collected. What I will say is the concern of less testing is that if we have less testing, we have less samples to select from, which then could be, will we miss variant opportunities because we're not testing at such a robust level. So I think that's a concern when I think about the numbers of just pure samples collected. I hope that
Do you guys have a contingency plan if a variant were to show up here in Erie County? Is there some kind of a go plan for that contingency?
So that's a really great question. I hadn't thought about like a different plan or a different strategy based on a variant. So the answer is no. However, I can tell you that testing is still a major priority of the Erie County Department of Health. We're actually still in negotiations for some larger testing opportunities in Erie County. Since the new federal administration has made available some additional resources, we'd like to leverage them here for Erie and get some more testing available. We're still working out the details of that, so I won't be announcing that until we know more. But with that being said, we're not changing that one thing's more important than the other. As I've said for a very long time, disease containment is still going to be very necessary moving forward. So every case that's identified, we're going to contact them and try to keep all of their contacts quarantined as long as that's the strategy that we need, because it's going to take time to get 85% of the population appropriately vaccinated. So we're still going to need testing, disease investigation, contact tracing, and vaccine, plus wearing the masks and still keeping our gatherings small. These are all the things that we need to do to really get through this pandemic. We're closer, but we're not there yet. Thanks
so much.
Jet TV, Chelsea, do you have a final question?
Yes. Over the last couple of weeks, county officials have said that this delay in vaccine rollout is the result of underfunding of the health department. Is that the problem, or is it the lack of vaccine availability?
I'm not sure where you're hearing this about the lack of funding. It is the lack of availability. If there was more vaccine available, that vaccine could get into the arms of people in Erie County. There's capacity at the hospitals and the other healthcare providers in this community, so I'm not sure where you're getting the messaging that it's a funding issue. It's truly a vaccine availability issue. Thank you.
I believe you said something about that last week.
I don't remember saying anything about this being an issue with the vaccine. I've said over and over again that public health in general has been underfunded for decades in this nation, certainly in this Commonwealth, and even locally here. So we did not have the infrastructure and the manpower that we should have had when this pandemic hit because of that underfunding. And that happened across the Commonwealth, and as I said, truly across the nation. Thank you. Erie Times News, David, do you have a final question?
Yes, I do, Kathy. We've been hearing the last couple weeks from the Biden administration about the importance of getting schools open for there to be more in-person learning going on. Has that sparked in Erie County or with state officials any more discussion of moving teachers up the list? In other states, teachers are getting vaccinated. That's generally the case in Pennsylvania unless they are otherwise in phase 1A. Has there been any discussion that you or Melissa have heard in recent weeks about getting teachers vaccinated?
I've heard nothing further about them moving up to 1A. They are in 1B, as we know. I believe you were talking about should we prioritize within the groups. I think teachers definitely need to be prioritized when we get to 1B. That's my personal opinion. But we also know we have a number of teachers in our school districts who are actually in 1A because maybe they're 65 and up, or maybe they are 16 to 64, but they potentially have heart disease, or they've had cancer, or they have some other medical condition that would put them much more at risk. So there are some teachers who definitely are in the 1A category because of their own personal situation. And I'll ask Melissa if she's heard anything more about teachers being moved to a different level.
I have not heard of teachers moving up into the 1A category, but I can, not that this is really helpful, but there has been conversation amongst vaccine providers that they believe teachers have been overlooked as far as a profession in their prioritization. So if there is appetite to change that, I think locally we are very receptive to that. But we've not had discussions that it will be happening. Thank you.
Does it have to go on a statewide level for it to happen? Is there anything that the county could do on a county level once there's a bit more vaccine?
It technically has to stay within the state level. That's correct. I'm not sure what the best argument that would be had at a local level that would make that happen.
Thank you.
Thank you.
Erie News Now. Ethan, do you have a final question?
I do. One final one for Director Lyon. You're going to hate this one, but we're now a month past Christmas. We didn't see a huge spike from Christmas. Indeed, we've seen cases and hospitalizations plateau. However, we now have the looming threat of these new mutations, these new variants. So if you had to describe how you feel about the situation at this moment, what's the pulse of in the public health sense?
Yeah, thank you. I do always worry. That's my job, is to worry about what could happen or what's coming up, and my job is also to be prepared for the worst. So I tend to fall into the category of, I think we still have some rough weeks and months ahead of us, and I frankly hope I'm wrong. I really hope the vaccine becomes available widely, we get ahead of this thing, and I'd love to be wrong, that the weeks just get better and better as we move closer and closer to spring. Thanks, Ethan.
Thanks.
Thank you. And final question, we're going to go to you, Joel, for Talk Erie.
Yes, this one's for you, County Executive. you're on the record as saying you're concerned about sports in schools being a context for spreading the virus. Can you explain your thoughts on all that?
Sure. I think our schools have done truly a phenomenal job of trying to keep both their students and their faculty and administration and other employees safe. But we have seen numerous schools, I'll say, in Erie County who've had to go from an in-school model to a virtual model for a number of weeks because of outbreaks. Many of these outbreaks have been related to sporting activities, whether they're the school sporting activities or a club sport. And honestly, much of that has happened around things that don't even happen within the actual game or the actual sporting sport happening. It may happen with carpooling, for example, putting kids on the bus together. Places, again, where the students are with people they don't live with, maybe masks on, maybe not, we're not sure, but that's where we're seeing a lot of these outbreaks coming from the sports in general. So I just ask everyone to please, if you are involved with sports, if your children are involved with sports in any way, you need to be extra diligent in how they are transported and how everyone behaves with these mitigation efforts while you are at the events, including the family members who might be there observing it.
Thanks.
Thank you. We want to keep our kids in school as much as we can. We know school is important to them. So I want to thank all of our media today and for all those great questions. I want to thank Director Lyons again for joining me. One last star business just to report before I finish up here today, and that's Dickey's Barbecue Pit in the Liberty Plaza, who has many safety measures in place. Signs posted, plexiglass in place. They also offer curbside pickup and delivery options. And to all those businesses who are out there working so hard to keep our community safe, thank you again. I know it's not easy. Sometimes you are confronted by people who get angry with you, and I thank you for doing your part to try to keep us safe. As always, ask each one of you to please do your part to keep our community safe. Always wear your mask. Stay at least 6 feet away from people that you don't live with in your own home. Please make sure you stay out of crowds, stay home as much as possible, wash your hands frequently. Throughout this pandemic, please stay safe and please stay calm. Thank you.